The views, opinions, and presentations of the guest are not intended to establish a standard of care to be followed by the audience. Always seek the advice of your physician or other qualified healthcare provider with any questions or concerns you may have regarding your health. Furthermore, the assumptions, views, opinions, and insinuations made by the host and guest do not reflect those of the show and the management. Zach at Zydus brings you a patient care program, Health Talk, a lay forum that gives various information on illnesses and diseases with advice from medical experts. Join us live on Facebook.
Good afternoon po sa inyong lahat. Masantos na ngaram si kayo namin. Maayong hapon sa inyong tanan. I'm Aga Aison. Welcome to today's episode of Health Talk, your weekend source of good talk on good health, Health Talk. It's our 10th week already of doing this lay forum that aims to promote health awareness and guidance with the help of our guest health experts. Of course, our doctors from different specialties and discipline. So happy 10th weekary to Health Talk, and thank you for your continued support to the program and of course to Zach at Zydus Facebook page. Today is also special because it's our birthday episode. So we're celebrating our birthday here in Health Talk. So thank you for joining us this afternoon. And for today, we are going to talk about allergic rhinitis and associated diseases involved because in allergic rhinitis, it's not just about the nose. So usually kasi pag allergic rhinitis, tama po ba? Ito yung we have itchiness of the nose, sneezing, whether umaga, tanghali, or gabi. Siyempre, nandiyan din yung runny nose. So laging nose yung affected, no? Or manifestation of allergic rhinitis. But did we know that it's just the tip of the iceberg? Sabi nga nila, no? So there's further diseases associated with uncontrolled allergic rhinitis. Now, that sounds really interesting to learn about. At yan nga yung pag-uusapan natin ngayong hapon na ito. Of course, kasama natin, we have invited an ENT expert or ears, nose, and throat doctor to tell us more about this topic. So our speaker for today is a graduate of the University of the Philippines College of Medicine. She had her specialty residency training for otorhinolaryngology, head and neck surgery at the UP-PGH. She completed a fellowship in otology at the University of Minnesota with Dr. Michael Paparella and graduated at Masters in Health Professions Education at the NTTC UP Manila. Presently, our doctor speaker for this afternoon is the director of the Postgraduate Institute of Medicine at the UPCM, where she is also a Professor 1. She is an attending otorhinolaryngologist at the Asian Hospital and Medical Center, Manila Doctors Hospital, Medical Center Manila, and UP-PGH. She is a fellow of the Philippine Society of Otorhinolaryngology, Head and Neck Surgery, and the Philippine College of Surgeons. So friends, without further ado, let's welcome our speaker for this afternoon, Dr. Teresa Luisa Cruz.
Thank you very much. Thank you very much, Aga, and happy birthday to you. Thank you to Zaidus for inviting me here this afternoon to share in this layman's forum. I'd like to now start our sharing. So you relax, and I hope as I go along, if you have some questions in your mind, you may list them down so you don't forget, so that at the end of this module, we can discuss the concerns that you have. Because I know allergic rhinitis is actually almost a household term already, because many people are familiar with it in their personal lives. So this module is entitled Allergic Rhinitis It's not just the nose. So, as Aga mentioned, this is a condition that is characterized by symptoms. It's a disorder of the nose induced by an IgE-mediated inflammation of the nasal membranes after allergen exposure. Pardon me for some technical terms. IgE is an antibody that mediates inflammation. So if we inhale something we're sensitive to, then the chemical IgE mediates the resulting swelling and inflammatory processes that leads to the symptoms in the nose. And these are nasal congestion, nasal discharge, sneezing, and itchiness of the nose, the palate, and even the eyes. So the patient will usually come to the doctor, not really anymore sometimes for sneezing or for itching, but the most common reason we found out why a patient with allergic rhinitis nowadays will go to a doctor is the bothersome nasal congestion. So, pagbarado ang ilong, yun ang pinaka mas nakaka-bother sa isang pasyenteng may allergic rhinitis. Pardon me, I think my Wi-Fi is not okay. Jay, how do I do this? Escape?
Pabati po ninyo from different parts of the country. Maraming salamat. Mukhang matatabunan ng pagbati yung mga questions mamaya. But of course, syempre, our speaker will be delighted to answer all of your queries later on. Ayan. So, maraming salamat for joining us this afternoon. No? It's Sunday afternoon, maulan. You are supposed to be with your family, pero quarantine naman. So, I'm pretty sure na nasa bahay lang tayo dahil sabi nga nila bawal lumabas. Bawal lumabas unless it's essential that we really have to go out of our own houses. Ayan. So, stay with us as we fix the internet connection so Dr. Techi could continue or resume with her presentation on allergic rhinitis.
Thank you, Aga, for taking over.
Yes.
I apologize
It's okay,
to our dear audience because really the Wi-Fi has been iffy for the past few days in the afternoon. So I switched to the LTE already. So sorry again. So I'd like to say that patients actually, because they've been having allergic rhinitis for some time, they've learned to depend on over-the-counter medications, but they go to the doctor, as I mentioned, if they are bothered by nasal congestion, pagbaradong-baradong ilong. So, is in Filipino adults. According to the study of our friends from PGH, Dr. Abong, in an urban population, surprisingly, it's even lower than in the rural population. In the rural population in our country, it's about 22.1%, while in the urban population, the prevalence is 18% of the population. So, but don't despair, sometimes I have our kababayans from abroad going to my clinic and saying, Doktora, when I'm in the Philippines, that's when my allergic rhinitis acts up. Pag nasa Pilipinas po ako, kasi ang dumi-dumi sa Pilipinas, ang polluted, kaya po mas inaatake ang aking allergic rhinitis. At ako po ay pag nasa ibang bansa, mas okay po ako doon. And then, the nationalistic in me comes out and I educate my patient and I say that, ma'am, mawalang galang na po. Hindi po Pilipinas ang nag-iisang dahilan kung bakit may allergic rhinitis. All over the world po, tumataas ang prevalence ng allergic rhinitis. Kahit po mayayamang bansa, marami pong may allergic rhinitis. Meron po tayong mga kababayan, pag nasa Pilipinas sila, mas maigi sila kesa sa pag nasa ibang bansa. It just so happen po sa inyo, ang inyong allergen most probably nasa Pilipinas. Kaya mas may atake kayo pag kayo ay nasa ating bansa. So prevalence of allergic rhinitis in different regions of the world is quite comparable to ours and even goes as high as 54.1% in Africa and 45.2% in the Middle East. And worldwide, allergic rhinitis affects between 10% to 30% of the population. And this also has a significant prevalence in children, not just in adults. So in children, they may not be just complaining of sneezing or nasal congestion or watery mucus coming from the nose, but they may also be snorting, yung gumagano po, laging may mannerisms, laging what we call the allergic salute, always upturning their nose because they cannot breathe well. So those can be the symptoms in children. So how does it happen? We call that pathophysiology. As I mentioned, some individuals are genetically susceptible. Yan po ay namamana natin sa ating mga ninuno o sa ating mga magulang. There can be a genetic predisposition. It's in our genes, and when those genes are stimulated, that's when the process begins. So it begins with us inhaling particular substances in the air. The most common allergen worldwide causing allergic rhinitis is still house dust mite. This is present in our pillowcases, in our beddings, sa ating pong mga mattresses, in the rugs and carpets in our bedrooms, and in the curtains. Of course, there's also a significant contribution of pollen and grass and certain plants and animal dander. So for those of us who have pets, dogs, and cats, they may be shedding dander to which family members may be allergic to. So the allergens, as you can see in the picture, on the right-hand side, this is the molecular process that goes on inside our body. The allergen enters our nose, crosses the lining of the nose, goes inside the circulation, and causes a cascade of reactions, primarily with histamine as the mediator. Kaya po naririnig nyo ang isa sa mga gamot na iniinom natin sa allergic rhinitis or any allergy for that matter is histamine. Because the main mediator or chemical that causes all these symptoms in the early phase is called histamine. And it leads to the nasal congestion, the watery sipon, rhinorrhea, the sneezing, and the nasal itchiness. And later on, other chemicals come into play or other mediators that bring us the late phase of the allergic reaction. So, isa po itong proseso. Gaano po kabilis ito from the onset? The onset can be within minutes after inhalation of the allergen. So how do we know it's allergic rhinitis? The doctor just says, oh, you have allergic rhinitis, gano'n na lang. Well, the doctor has a responsibility always to take a good and complete history of what the patient has. So we ask for the patient's chief complaint complaint. Ano po ang inyong nararamdaman? Ano po ang dahilan kung bakit kayo nandito sa ating clinic? And as I said, the patient usually starts off with, baradong-barado po ang ilong ko. And of course, we ask for the associated symptoms. As mentioned, sneezing. May sipon po ba kayo? Yes po, may lumalabas na sipon. Ano pong itsura ng sipon na lumalabas? Matubig lang po, usually. Opo, clear naman po, or watery. Do you have fever? Because fever is not a sign of allergic rhinitis. Fever is a sign of infection. So allergic rhinitis that does not present with fever. It does not present with pain. So, and then we ask about the onset, ilang araw na po yan, the duration, and the possible predisposing factors. No? This usually entails even going through the personal history of whether the patient has pets, where the patient lives. Did the patient suddenly just move? Like if the patient says, so we ask, when in your life, for example, you have a 27-year-old patient like Boss Aga, whose birthday is today, as I mentioned. So, sasabihin po ng pasyente minsan, Tita Doc, hindi naman po ako ganito eh. Mga 3 months ago lang po nagsimula. Ganito na ako lagi. Buong buhay niyo po, hindi kayo ganyan? Yes po eh. So, I asked the patient, so sir, meron po kayang pagbabago sa buhay nyo 3 months ago na nakakapagdulot sa inyo ng symptoms ngayon? Are there any changes in your life that's new? Therefore, these new symptoms are occurring. And then they suddenly say, oh yes, Doctora, ever since we had our renovation or ever since our neighbor started building or constructing their house, there was a lot of dust, or ever since we acquired this new dog. So that can be it. So by history alone, we already suspect that the patient most probably has allergic rhinitis. And then we do our physical examination. We find in the ENT when there is allergic conjunctivitis, some redness of the eyes, some nasal crease because patient keeps on upturning the nose and there is already a dark crease here. And then we look inside the nasal cavity and we see the findings of allergic rhinitis. There's swelling, there is grayish turbinates or the structures in the nose, and there is a clear or usually thin sipon or mucus. And when we have to be pushed to the wall and ask what is the definitive diagnosis of allergic rhinitis, then the standard is an allergy skin test. This is a test by which the various allergens, as shown in the picture, are injected into under the skin of the patient, and if a reaction is observed, that's a positive test that the patient allergic to that particular substance. But we don't usually need the results of a skin test. We usually just need the history and the physical examination to start treating or managing our patients already. So how do we manage or how do we treat allergic rhinitis? There are general principles in the management of allergic rhinitis, and they should go hand in hand with each other. And these are environmental control, pharmacologic therapy or medications, immunotherapy, and very important is patient education. So I always say to my patients, wala pong kwenta ang mga gamot kung patuloy tayong nasa environment na punong-puno ng allergens to which we will react to. So environmental control is very important for the containment of the disease or of the condition. And of course, patient education. Aside from pharmacologic therapy, and sometimes if medications don't work anymore, then we refer to our partner allergologists for immunotherapy. What is the goal of treatment? Ano ang layunin ng pag-manage ng allergic rhinitis? Ito ba ay para sa cure? Is this to cure the disease? Is there a cure for allergic rhinitis? Doktora, lagi na lang po akong binibigyan ng gamot. Then after 2-3 weeks after the medications, I have my symptoms again. Nagsasawa na po ako? Wala po bang permanent cure para dito? As of now, there is no permanent cure for allergic rhinitis. Bakit pa po niyo ako binibigyan ng gamot? Wala naman po palang cure. Then we have to explain to the patient the goals of the treatment. Why am I controlling your allergic rhinitis? One, to resolve the symptoms of the episode of allergic rhinitis so that you, my patient, will be functional and comfortable, because the symptoms can bother your sleep, can bother your work, can bother the pleasurable activities that you want to engage in. So we manage this so that you will be functional and you will be comfortable. And the second reason, which is just as important, is to prevent the development of unwanted sequelae and complications. And this is the bulk of the topic assigned to me by Aga this afternoon. That's why the title is Allergic Rhinitis. It's not just the nose. It's not just nasal congestion, sneezing. It's not just watery, bothersome runny nose. It's not just itching and post-nasal drip. Allergic rhinitis can also affect the eyes. In fact, it's not a complication. It usually goes hand in hand with an episode of allergic rhinitis. You have the so-called allergic conjunctivitis. Doktora, may sore eyes na rin yata ako kasama ng allergic rhinitis ko. When we say sore eyes, we mean usually infection of the eye. Allergic rhinitis is not an infection, it's an allergy. But the patient rightfully thinks, baka may sore eyes ako. Why? Because as you see in the table, redness is a characteristic of bacterial conjunctivitis, viral conjunctivitis, and allergic conjunctivitis. So how do you distinguish? In allergic rhinitis, this is mostly both eyes. Walang pinipiling side ang allergy. Pag may na-inhale ka ng allergen, it goes into your blood, the reaction is in your blood, and the blood affects both sides of the nose, both sides of the eyes, right and left. If you have sore eyes, if it's bacterial, it's usually just one eye in 50% of the cases, or one eye in 25% of the cases. So it's really bad luck if you have sore eyes for both eyes. Also, discharge, yung marami pong discharge, maraming nagmumuta-muta, rare po yun sa allergic rhinitis, pero common po yun sa sore eyes. And then the itchiness of the eyes is also rare for infections, both bacterial and viral. While for allergic rhinitis, it's common. Kanina pa po ako nangungulit, itchiness of the nose. Itchiness can also be in the eyes. And if you will, if the examining doctor will look at the underside of your eyelids, and they will see this cobblestoning appearance, which is very characteristic of an allergic conjunctivitis. So it's not just the nose, it's also the eyes. And the good news here is if we manage the allergic rhinitis, sometimes we don't even have to give eye drops anymore. Nakukuha na po sa oral medications to manage the allergic rhinitis ang allergic conjunctivitis. Now, from the eyes, we go down here to the lungs, which is bronchial asthma. This is not within my specialty. I refer my bronchial asthma patients to my colleagues in pulmonary medicine. But I just want to say that allergic rhinitis and asthma frequently go together, and there are a lot of excellent scientific studies that have given evidence to this fact. 40% of allergic rhinitis have asthma, and 80% of patients with asthma have concomitant allergic rhinitis. We even call the entity a united airway disease. And this is where medications, combinations of antihistamine like levocetirizine plus Montelukast are best used for, because Montelukast is very useful for asthma also. So aside from asthma, allergic rhinitis, I know are also can affect sleep, can affect cognition, especially in children, and can affect school performance and presence in the school. Now, I know that our topic is not just in the nose, but in the sinuses, which is connected to the nose, there can be an affectation of allergic rhinitis. It has extended from the nose to the sinuses. And aside from that, a common extension is to the ears, causing what we call otitis media, because the nose is connected to the ears. So here, you have allergic rhinitis, which can affect other systems or parts of the body. Now, let me go through one associated affectation beyond the nose, which is a viral infection. Maybe the common flu or influenza, not COVID-19, but a viral infection, the usual upper respiratory tract infection or flu that we get. Remember, allergic rhinitis is not an infection. Now, there are concepts that link the occurrence of allergic rhinitis to flu or viral infections. Tita Doc, pag may allergic rhinitis po ba ako, ibig sabihin mas prone po ako magkatrangkaso? The jury is out regarding the answer to that question. It is logical to assume, and sometimes doctors just flippantly say, ay may allergic rhinitis ho kasi kayo kaya yung immune system nyo apektado, madali po kayong magkatrangkaso. And it can be true because as you can see in the slide, this is my lecture for my co-doctors, allergic inflammation also has the ICAM1 receptor, which is a principal receptor for the rhinovirus, which causes viral infections. So there is information, I won't bother you with this. There is information saying that an allergic rhinitis patient may be more prone to flu or to viral infections than those that are not. Again, please, not the COVID-19, but the ordinary flu or ordinary viral upper respiratory tract infection. But there is also evidence that allergy may actually be protective against viral upper respiratory tract infections. So as I said, for this, the jury is still out. So after I learned this, because I researched on this, because I used to just flippantly say, I'm guilty of that to my patients about maybe 7 years ago, a decade ago, prone ho kayo magka-viral infection, but this is not entirely true anymore. So I explained to them when they ask that it can be not, but we are still studying it. Experts are still studying it. Another one is, as I said, sinusitis. So what are sinuses ba actually? Sinuses are empty, air-filled spaces in our skull. I always compare the sinuses to rooms, mga kwarto, at ang corridor ay ang ating ilong. They extend to rooms called the sinuses. So whatever is affecting the nose can also affect the sinuses. So a person who has allergic rhinitis may be prone to having allergic sinusitis or even infectious sinusitis. Because with allergic rhinitis, you have blockage of the nose, you have blockage of the sinuses, you have pooling of the mucus and secretions. Even though it started as an allergic mucus or allergic sipon, it can become a nidus for bacteria to invade and therefore cause our sinusitis, which by this time, we already have to add an antibiotic against bacteria if it's a bacterial sinusitis. So who wants that? Who wants an antibiotic? Who wants sinusitis? That's why we want to control the rhinitis because we do not want it to become sinusitis. Another one, again, sorry, it's not in the title because it's still in the nose, but I want to mention that allergic rhinitis may be linked to the development of nasal polyps. Again, there is evidence that it may be linked or it may not be. But it can be logical to assume that it is linked, and this is what you see when you have nasal polyps. You know, I have patients that come to me who are very worried. They come to the clinic, they say, Tita Doc, tumingin po ako sa mirror eh. Parang natatakot po ako kasi may bukol po yata ako. And then, usually, without any symptoms, sa isip ko, I already know, no, si ma'am just saw the turbinate. This is the nasal turbinate, as I'm pointing out with the arrow in the picture. Hindi po yan bukol. Lahat po tayo meron yan. That's a normal bone lined with pink mucosa found inside the nose. Now, this one is the mass. It's called a nasal polyp. Nasal polyps are not cancerous. They are benign, grape-like masses, para po siyang ubas that can be found in the nose. So, who wants nasal polyps? We control allergic rhinitis because they might lead to nasal polyps. Nasal polyps can be treated with medications, but sometimes they cannot be resolved with medications, and patients still have to undergo surgery. Who wants to undergo surgery? Nobody wants that. So if we can control allergic rhinitis, let's control it so we don't have these complications. Another one is otitis media with effusion. I think this is the last that I'm going to discuss today as an associated outside the nose condition of allergic rhinitis. I mentioned that the ears are connected to the nose. So look at these pictures which explain that connection. The ear of human beings, I always say, ang alam lang po natin na tenga ito eh, no? We have to realize the ear is so much more, and much of it is inside our skull. We cannot see it. We think this is our ear. We ask our kids when they are young, where is your ear? And we're so happy they do this. This is the ear. Yes, that's the ear. But most of the ear is inside our skull. The ear is divided into the outer ear, the middle ear, and the inner ear. Nagkakaroon po tayo ng problema dito pag masyado tayong nagko-cotton buds, masyado tayong nagsiswimming. Hindi po yan ang related sa allergic rhinitis. Ang related po sa allergic rhinitis are conditions in the middle ear. Because the middle ear is connected, as I'm pointing out in this slide, by the eustachian tube, going to the left picture, to the nose, the nasopharynx, which is the back of the nose, up to the mouth and the throat. So whatever condition we have here can affect the middle ear through the eustachian tube. Doktora, yung anak ko po, ilang araw nang sinisipon. Tapos po ngayon, di na po makarinig, para daw pong punong-puno ang tenga. Kasi po, ang middle ear po ng tao, para makarinig tayo ng mabuti, should be air-filled. It should be filled with air. Hangin po ang laman. Pag ang middle ear ng tao po ay nalagyan ng fluid, in the case of otitis media, if it becomes filled with mucus or sipon, then we have loss of hearing, feeling of blockage, and sometimes when it gets infected, we have severe ear pain. So, it's called otitis media with effusion. It's not yet an infection. It's the presence of fluid in the middle ear because of its association in the nose. Look at this. It affects 90% of children before school age. The most common cause is allergic rhinitis or a viral rhinitis. Again, as I said, this is an accumulation of fluid in the middle ear behind an intact eardrum or tympanic membrane. There is no hole. Walang butas ang eardrum. Ito po ang eardrum. Going back to the picture, this is the eardrum. It seals the middle ear. So there is no hole and the fluid is stuck there. When there is a hole, that's worsening of the disease. Doktora, nawala na po yung bara, pero may lumabas pong sipon sa tenga. Butas na po ang eardrum nun. It's the most frequent cause of hearing loss in children. It can be self-limited or resolved spontaneously as long as you resolve the inciting factor or the root of the cause. Deal with the ugat of the problema so you will control the effect of the problem. The link between otitis media with effusion and allergic rhinitis also has been proven in many elegant scientific studies. So there's a lot of evidence. So if, as I mentioned, that fluid already becomes infected, it just like sinusitis, it becomes painful. The child may have fever, and that is already not otitis media with effusion, but already acute otitis media. Doktora, iyak po yan ng iyak kagabi. Kasi ang sakit-sakit ho ng tenga. Why hindi sasakit? There is pressure, accumulation of fluid, there is swelling, there is redness because there's already an infection. Pero kaninang umaga po, hindi na po siya umiiyak. Pero meron na pong lumabas sa tenga na parang sipon. Bakit ho yun nangyari? I always compare para pong ang middle ear is a space. It's a confined space. May pressure, puno, maga, parang pimple, ang sakit. Nung pumutok ang pimple, hindi na siya masakit. Pumutok na ang eardrum, hindi na masakit. Don't distress. If it's just a small perforation and you catch the infection early and proper treatment can be instituted, the eardrum can heal 100% to its original state. Control the infection, control the allergic rhinitis. So gusto pa ba nating mabutas ang eardrum? Gusto pa ba nating magpunta ang sipon sa tenga? Ayaw natin yon. Ayaw nga natin siya sa ilong eh. So let's control the allergic rhinitis. As I said, there's no cure. You have to be educated that there's no cure. So prevention is very important. Through environmental control, and when there is an attack, we give medications. Hopefully, it will be controlled. If it's uncontrolled, we refer for immunotherapy, and patient education is very important. Environmental control. Number one is house dust mite. So you provide adequate ventilation in your surroundings. You wash your beddings and your pillowcases regularly. You encase your pillow, mattresses, and quilt in ideally allergen impermeable covers. You can use your vacuum cleaners with HEPA filters. Dispose of your feather beddings, your carpets, and your curtains. And remove your pets, your stuffed toys, your books. Lahat po ng naghahakot ng alikabok, itago nyo sa loob ng cabinet. Huwag po naka-expose. So here you have your bedding encasements, your HEPA filtration, HEPA for cats and dogs, not really for house dust mite. The HEPA filters for the vacuum cleaners, good for house dust mite, but reduction for the humidification, also for dust mite, for cockroach, thorough cleaning. So this is what I say about the need for skin test. Doktora, hindi ko po ba kailangan magpa-skin test bago nyo po ako resetahan ng gamot? So I say, alam nyo po, alam na po natin ang mga common allergens eh. Nandyan po, number one, house dust mite. mga pets, mga cockroach. Pag lumabas po sa skin test nyo na allergic kayo sa house dust mite, pwede na po nating i-assume yun Pwede na po tayong maggamot. Paano po yung cockroach? Bakit po? Sasabihin ko sa pasyente, pag lumabas po ba sa skin test, hindi kayo allergic sa cockroach, aamuyin yung cockroach? Hindi rin naman, di ba? Dapat cleanliness is next to godliness. You don't need a skin test to say you should avoid dust, you should avoid cockroach. So kailan ko po nire-recommenda, Doktora, we cannot live without our dog. We love him so much, but we are all having allergies and we think it's because of him. Oh, let's have a skin test because it's affecting them so much. I cannot just say to them, let's get rid of your dog, especially in the United States when I was there. I cannot just say to the kids, it's the dog, you have to get rid of it. You're getting problems in your ear. Then we do the proper skin test to identify the allergen before we can say it's the dog. And they decide. If it's the dog, then they decide. If it's not the dog, ay salamat, it's not the dog. And of course, we have medications. Honestly, intranasal corticosteroids, antihistamines like levocetirizine, Montelukast, these are the usual that we give to our patients. Immunotherapy, as I said, this is the repeated administration of an allergen extract in order to induce immunological tolerance. We refer this to the experts who do it, the allergologists. Usually, this can be given via the subcutaneous injections, or nowadays, they also have the sublingual immunotherapy. Very important is patient education. We have to spend time explaining, as I said, the goals of treatment so the patient will keep to environmental factor control, understand why medications are being given, avoid allergens, and when we prescribe medications, give details so that patients will be compliant, warn them of possible bad side effects. And very importantly, when we prescribe intranasal steroid sprays, we have to demonstrate ganito po ang paggamit. Usually the dose is 1 spray per nostril 2 times a day. So chin down a little, prime your nasal spray so that a mist comes out. You're sure there's something inside. Cover 1 nostril, put the nozzle inside the nose, direct the nozzle to the side of the nose, away from the middle or the nasal septum, chin down, inhale gently, and do that for the other side. In the internet, you'll find a video saying cover 1 with the left hand and use the right hand for the nozzle. The other one, cover the left hand and use the right hand. The important principles there are chin down, sniff a little, not too much, because if you sniff it too much, it goes all the way to the back of the nose and you just swallow most of it. Then very important is to direct the nasal spray to the side of the nose and follow your doctor's instructions and contact your doctor at once. Stop the medications if you encounter anything. You can have allergies to anti-allergy medications. I've been witness to that. I prescribed an antihistamine. Patient was allergic to the antihistamine. So you always have to listen to your doctor. Let us all band together to control allergic rhinitis. There is no cure, but if we follow the general principles of management, hopefully we will be able to control it to provide comfortable and functional lives and complication-free conditions for our patients. Maraming salamat po sa inyong pakikinig.
All right. Thank you very much, Dr. Techi, for that very, very clear discussion about allergic rhinitis and associated diseases to allergic rhinitis. So, isa itong napakagandang reminder po para sa public na not to take allergic rhinitis for granted. dahil may mga epekto ito sa iba't ibang parte ng katawan, as you said, Doktora, no? Particularly the respiratory system. In our ears, sa throat, sa lungs, marami. And it's very, very scary as well dahil may allergic rhinitis ka na, nadagdagan pa, no? Yung sequelae, as you mentioned, of unwanted events. So maraming salamat, Doktora, for the very thorough discussion about allergic rhinitis. Ayan. So, I'm pretty sure marami po sa inyo ang gusto magtanong pa or maklarify pa yung iba't some other things siguro na gusto niyo pang mas tanungin sa ating speaker for today. So, please put that in our chat box. You could ask your question to our health expert for today. And of course, Dr. Techi will be happy to answer all of those questions. Ayan. All right. But before we entertain questions po, Doktora, I have 2-3 questions for you. First question po, Doktora. This is kind of basic, pero pag nagka-allergic rhinitis po ba ay tuloy-tuloy na ito? Or is it sort of saying, is it a lifetime disease? Or pwede po itong mawala?
Okay. So, yes, thank you very much, Boss Aga, for that question. Actually, as I said, nasa genes po natin yan. It's the disease is caused by genetic factors and environmental factors. So it's just like asthma. We even say that the nose is the allergic rhinitis is the asthma of the nose. No, so it's inherent. It's with you. You were born with it. And then I joke pa nga, my very good friend, Pia de los Reyes Yang, sabi ko sa kanya, mistisa ka kasi, kaya kami allergic rhinitis. Kasi I thought before, it's really the Caucasians who have this. But as I showed in the epidemiology, kahit Pinoy na Pinoy, meron talagang allergic rhinitis. So, to answer the question more directly, it will be with you for your entire life. As of now, I cannot say, mankind is very intelligent, and with God's grace, baka maka-invento tayo in the future, biologicals or cure or stem cell for allergic rhinitis. But as of now, if you have it, you'll have it all your life. It will just be controlled.
Ayan, all right. So thank you, Doktora, for clarifying that, no? Another question po, and it's a follow-up question, is that kapag mayroong allergic rhinitis, automatic po ba na meron tong sequelae of event or pwedeng sa nose lang?
Very good question. So, as I said, pwede siyang sa nose lang. That's why we want to control the symptoms or the disease process when it's just affecting the nose. Doon po sa mga sinabi kong extensions niya, ang pinaka-common po ay yung allergic conjunctivitis, yung sa mata. It's not even considered a complication anymore because of its high co-occurrence with the nasal symptoms. But that's po our advice in this lecture, na kaya po tayo nangungulit na wag nating pabayaan ang ating allergic rhinitis kasi po it can lead to complications. But it is not automatic. If we have good control of our allergic rhinitis through environmental control, medications, sometimes immunotherapy, and we follow what our doctor's advices are, then usually complications will not happen naman po.
Ayan. All right. At least naklaro po yung doktora. So dapat talaga maagapan po, no? To avoid further complications. And control, as you said, is the key para po to prevent those sequelae of events. Ayan. Now, Doktora, let's entertain comments and questions from our Facebook Live viewers. There are over 100 of them, and of course, counting. Ayan. So we have a comment from Eldocap Medina. At sinasabi po niya that he or she has allergic rhinitis, sometimes lead to sinusitis and asthma attack. So my sense of smell has been very low to none, all for about 4 years. So what can you say about this, Doktora?
Okay po. Again, thank you for the question, Mr. or Miss Medina. Ang asthma po ay talagang, kung hindi kakambal, at least kapatid ng allergic rhinitis. Kasi po, United Airways siya eh. Kung ano man pong sensitive ang nose natin, pag nakarating po sa ating lalamunan, nakarating sa ating baga, most probably sensitive din ang ating lungs, and that is asthma. So, yun po ay given na. Talagang, as I mentioned earlier, the evidence is strong for the link between allergic rhinitis and asthma. Translating that to management, you have to control your allergic rhinitis because studies have shown if you have good control of your allergic rhinitis, there are less visits to the emergency room for a problematic asthmatic attack. So that's what the evidence says. Now, doon po na, so yon, good control of allergic rhinitis can lessen bad asthma attacks for patients with asthma also. With regards po to the sense of loss of smell, which we call anosmia, gusto ko lang pong banggitin dito na baka hindi naman po palagay ko lingid sa inyong kaalaman na sa kadami-damihan na ng information about COVID-19 na anosmia can be a symptom of COVID-19. Pero please, wag po kayong matatakot, Mr. or Miss Medina, dahil ang importante po sa sinabi nyo ay 4 na taon na kayong walang amoy. Wala pa pong COVID-19 4 years ago. SARS-CoV-2, 2019 virus lang po siya nagkaroon. So palagay po, hindi naman COVID-19 ang dahilan ng inyong kawalan ng pang-amoy. Pero concerned po ako kasi po, hindi rin po usual na simptomas ng allergic rhinitis ang kawalan ng pag-amoy or decrease in smell. It still might be, pwede pa rin po na allergic rhinitis lang yan, pero mas mabuti po, let's go to our nearest ENT doctor when you have the time and when the numbers of COVID-19 are lower, most probably, di naman po emergency, 4 years na yan. When the numbers are lower, we are more stable, we are safer, please go to the ENT doctor because your nose has to be examined because there might be other causes for your decreased sense of smell.
Ayan, thank you very much po, Doktora. I'm pretty sure si patient Mr. Hermes Medina ay marami pong natutunan sa inyo pong naging kasagutan. Now we have another question from Ma'am Maria Cristina Lopez Rojas. Normal po ba, Doc, na magkaroon ng post-nasal drip pag may allergic rhinitis?
Very good question, Ma'am Cristina. Yes po, normal na normal. Kasi actually po, ang post-nasal drip ay may, again, kapatid, ito po yung anterior nasal drip. So ang scientific name rin po for rhinorrhea or sipon coming out as we know it through the front is anterior nasal drip. And sipon from the nose going to the back and falling to the throat is posterior nasal drip or post-nasal discharge. And so that posterior nasal discharge can be a symptom of allergic rhinitis and sinusitis.
Ayan, thank you, Doktora, for clarifying that question. Now, another question from Ma'am LJDC. Sensitive po ba ang pang-amoy like pag sa soap and alcohol sumasakit ang ulo pag may allergic rhinitis?
Okay. Ma'am LJ, very good question. Tsaka very good, very common scenario. Doktora, pag naaamoy ko po yung pabango nung office mate ko, sinisipon na ako . Doktora, pag nakaamoy po ako ng masangsang na amoy, Doktora, in Ma'am LJ's case, alcohol, no? Strong odors can irritate the nose, not necessarily causing an allergy, but can cause irritation that will lead pa rin po to swelling of the inside of the nose so there's swelling, so there's nasal blockage, and since it was irritated, the response of the body is to produce the discharge. But this is not necessarily allergy. It is what we call non-allergic rhinitis or what we call vasomotor rhinitis. And the treatment is the same for patients who are healthy without hypertension. We can give our decongestants, our saline nasal spray. Don't forget our nasal spray na saline, which is available commercially in sterile preparations. And of course, our intranasal steroid sprays can be used also for vasomotor rhinitis.
Ayan. Swerte naman ng mga nagtatanong, doktora, mayroon ka ng reseta kaagad. No? May diagnosis and prescription. But of course, kailangan may either online prescription, no? E-prescription or the written prescription para po maganda puntahan po nila yung mga ENT na gaya as your advice.
Yes
Ayan.
po.
Salamat po, doktora. We have another question from Ma'am Carol Magsakay. Sobra po ang allergy ko sa cigarette smoke at sobrang bango na perfume kung kailan nagkaedad saka lumabas ang aking allergy. So, this is a question of age, doktora. When allergy comes out. Meron po bang certain age po ito nangyayari or pagkabata, matanda?
Yeah, so just like genetically linked diseases, sometimes there is a certain timing or a trigger for which it will be manifested. So, nasa genes na natin yan. Pwedeng may allergic rhinitis gene tayo, pero buong buhay natin di na nag-manifest. Kasi hindi umabot yung trigger, yung amount ng allergen to activate the gene. So most probably po, this is an adult onset sensitivity. Just like asthma po, baka po nababalitaan natin. Marami din pong pasyente sasabihin sa atin, wala naman po akong asthma nung bata ako kung kailan ho ako tumanda, saka po ako nagka-asthma. So, meron din pong temporal pattern ang manifestation ng mga disease depending on the circumstances.
Ayan. Salamat po, doktora. I think you mentioned also hindi lang sa genetic, environmental factors also.
Yes, the triggers.
Yeah. So,
yes, Aga.
So, kailangan talaga ingatan din, panatilihing malinis ang kapaligiran. And of course, kapag may nararamdaman ng medyo kakaiba, make sure to see your doctor para hindi na siya lumala.
Yes, bali po kay Ma'am LJ, medyo, si Ma'am LJ pa po ba yung last question o Ma'am Carol?
Ma'am Carol.
Ma'am Carol specifically said cigarette smoke and strong perfumes.
Yes po.
O edi ang dali ng solusyon kay Ma'am Carol, avoid cigarette smoke, avoid strong perfumes. Wala nang problema si Ma'am Carol. Hindi niya kailangan maggamot. Ayan. Avoidance is the key.
Tama po. Thank you. Thank you, doktora. Now we have another patient, Ma'am Strelia Lu. Ito po, she had, of course, sabi niya, thank you, doktora. You gave us a clear and comprehensive information about allergic rhinitis, which she had since she was 12 years old po. I am now in my 50s. It's on and off. I have a question. Lately, I have ringing in my ears. Went to ENT 2 months ago, pero he didn't find anything wrong as sa ears ko. Gave me eardrops for a week. I still have tinnitus. Should I be worried?
Okay po. Ito talaga po. Palagay ko, kung I trust po that your history says that you've been to an ENT specialist. And the ENT specialist did not find, I presume, anything in the nose as a cause for your ringing in the ears. So ringing in the ears is called tinnitus. Actually po, baka mga 3 webinars pa yon para matapos natin ang tinnitus. Pero in relation po to allergic rhinitis, tinnitus can occur, as I mentioned, if you have blockage in the ear or otitis media. However, in the absence of sipon, in the absence of nasal blockage, you just have isolated tinnitus, then it needs to be investigated po. Marami pong tinnitus na huwag kayong mag-alala, wala naman pong seryosong dahilan. Pero manaka-naka po, meron pong paminsan-minsan seryosong dahilan ang tinnitus. So ang advice ko po sa inyo, bumalik po kayo doon sa inyong ENT at i-update nyo siya na hindi po nagbago ang inyong nararamdaman dun po sa iniresetang eardrops.
Ayan. Salamat po, Doktora, for that instruction sa mga pasyente po na nagtatanong. Now, we have another question from Ma'am Christina po ulit. At sabi po niya kasi, tinatanong po niya kung communicable po ba ang allergic rhinitis?
Very good
Communicable.
question, Ma'am Christina. Allergy po siya, so siya po ay genetic na mamana and environmental pag may triggers. So hindi po siya nakakahawa, hindi po siya infection.
Ayan. Salamat po, Doktora. Ito naman para sa mga anak nila kasi marami tayong parents na nanonood po ngayon. And of course, to maximize this opportunity, they also have question for their family members as well. And this is from Imchilavitan Marbella. Good PM po, Doc. Yung anak ko po may allergic asthma. Ang magiging sign po sa kanya kapag nangingitim ang baba ng mata niya. Tapos, nagkakaganon po siya pag bigla po siya sinisipon at bahing na bahing na. Nagkakaganon po siya pag nagpapalit ang panahon, pag sobrang init at sobrang lamig. Ang ininom po niya ay Montelukast antihistamine. Okay lang po ba na palagi siya nagtitake nun? Advice po ng pedya niya pag 2 to 3 months siya ay gaganon. What do you think po, Doctor? How long do you usually prescribe that to your patients may allergic and asthma?
Okay, so remember that our goal is control of the symptoms and prevention of complications. In this case, asthma. So we give the medications because to control the allergic rhinitis of mom's anak, and because the child has asthma, we don't want the asthma. So the asthma has to be managed and the allergic rhinitis has to be controlled. So if I see such a patient for allergic rhinitis with some beginning asthma, I prescribe the combination antihistamine plus Montelukast for 2 weeks, with the advice that if the patient does not get better or if the asthma condition worsens, to go at once to the pulmonologist. So after 2 weeks, if they are fine, then they see me after 2 weeks, then I evaluate the patient. If the patient is status quo, not much asthma attack, but still with allergic rhinitis, then I can opt to continue the medications for about a month and then ask the patient to come again. With the advice that if there's any worsening, do not wait for a month, but to come earlier.
Ayan, thank you. Thank you very much po, Doktora. Now, I think we have maybe last 2 question po, if okay with you, Doktora po, no?
No problem. I want to apologize for the glitch in the Wi-Fi earlier because it's very dark here already in Alabang.
Yes. That's fine, Doktora. Very normal in the Philippines, wherever you are. Ayan. Okay, Doktora, we have doctor viewers as well po, Doktora, no? Of course, binabati po natin yung mga doctor viewers natin, and there are some also na contributing their inputs, no, on this topic. So we have an allergologist doctor watching us. So this is Dr. Fruto from Cebu. Hi, Doc. Immunologist po siya, allergologist po siya, Doktora, no? Since you mentioned about the overlapping of symptoms of allergic rhinitis sa COVID, Doktora, so parang input po ni Doctor is to highlight the additional valid reason to control allergic rhinitis. Many of its constellation of symptoms overlap with some of the signs and symptoms of COVID-19, and this will add to the diagnostic challenge of any physician who sees patients at the triage areas designated for COVID cases. If the rhinitis is well controlled, it will be one less diagnostic dilemma for the examining physician. Ayan. So tama po yung Sabi po ninyo, Doktor, that's why this is very important po, no, na allergic rhinitis, there are associated symptoms to overlapping to COVID-19. Kaya dapat, as early as possible, inaagapan po talaga itong allergic rhinitis. Let's not take it for granted. Hindi ito yung isisinga mo lang, sneeze mo, it's done, it's over. No? Tama po, Doktora, no? So, ang parting question po probably, Doktora, is with regards, if okay with you to relate it or to prevent further association with COVID-19. So, what can you tell the viewers today, Doctora? I know this is a bit far. No, not really far, but not really the topic because we would
No
like to talk about
problem.
nose. Now, medyo ilink natin ng kaunti sa COVID-19 dahil marami po ngayon ay napaparanoid at nagpapanik. Minsan allergic
Opo.
rhinitis. You mentioned about the loss of smell or taste, ganyan. Minsan po nagiging overlap symptom siya ng COVID-19. So, ano pong masasabi niyo sa mga pasyente po or mga viewers natin na nanonood? Allergic rhinitis in its relation to COVID-19.
Okay. Very relevant. Very relevant. Last question. As you said, Agang, galing mo talaga mag-moderate. You saved pa the most relevant for last.
Yes, yes.
Hindi po yan planted. Sinurprise po niya ako sa question na yan. Okay, so COVID-19, alam nyo na po ng marami sa atin, COVID stands for Coronavirus Disease 2019. The shortcut term is COVID-19. 19 because it first was discovered in Wuhan, China in December of 2019. This disease is an infection caused by an enveloped virus called a coronavirus. It's very much related to the virus that caused SARS. So there is SARS, which is actually SARS-CoV-1. Nilagyan na ng 1 kasi nagka-2 eh. Dati SARS lang yan. So now we have COVID-19, which is caused by the virus called Severe Acute Respiratory Syndrome Coronavirus 2 or SARS-CoV-2. Gaya ng kahit na anong impeksyon na respiratory, meaning involving the air passages of the human body, the nose, the nasopharynx, the throat, the mouth, up to the lungs, it causes symptoms of these parts of the body. Pero ito ay isang impeksyon. Ang allergic rhinitis ay hindi impeksyon. Sa history pa lang, kung maalam ka, alam mo na ang maraming differentials. Unang-una, ang allergic rhinitis, matagal nang meron ng pasyente usually. Hindi yan ngayon lang, 1 month ago, 2 months, unless talagang bago. Dati na siyang ganyan. May kaibahan po ba sa nararamdaman nyo dati? Wala. So what are the symptoms of allergic rhinitis? Sneezing, nasal itchiness, nasal congestion, and sipon. Okay. Sa mga yan, ano ang typical na meron rin sa viral infection? Pagpalagay na natin, nasal congestion at saka sipon. So having said that, pwedeng may allergic rhinitis ka, pero pwedeng may COVID-19 ka din. Hindi exempted ang mga allergic rhinitis patients sa pagkakaroon ng COVID-19. So kung pumunta sa triage, usually kaya pupunta hindi dun sa alam na nila na simptomas eh. Kasi alam na nila allergic rhinitis, usually telemedicine muna yan with their ENT. Pero kung pumunta, bakit pumunta? Kasi usually may bagong nararamdaman na hindi nararamdaman dati bilang isang allergic rhinitis patient. Number one, the most common symptom, gaya ng kahit na anong viral infection, lagnat, fever. Yung nasal congestion, yung sipon, maaring meron. Pero walang lagnat sa allergic rhinitis. May lagnat ang COVID-19. Pwedeng may sore throat. Pwedeng may loss of smell ang COVID-19. History, tanungin, may exposure po ba? With or without exposure, pwedeng may COVID-19. So, with regards diagnosis, yung sa symptoms, pwedeng may overlap at ang distinguishing factor is fever and sore throat. So, pwedeng may allergic rhinitis ka, COVID-19, sa mga walang allergic rhinitis, ngayon lang nagkaroon, sipon, fever, you have to go. Because alam naman natin, kahit nga walang simptomas, pwedeng positive eh. There is more than 80% statistics showing na COVID positive patients, more than 80% of them can be asymptomatic. Kaya nga takot na takot tayo dahil hindi natin alam kung yung kaharap natin may COVID-19. Yung pa kayang may sipon na. Okay. So, but if you go to the physician history, physical examination, vital signs, fever, shortness of breath is the one that will make you be confined in the hospital. Good news again, knock on wood, so far sa ating bansa, majority of COVID-19 patients have mild diseases. Kaya pinapauwi. Pag pinauwi, parang may trangkaso. Isolate, rest, take lots of fluids, gargle with your gargle. Do not practice practice physical distancing, hand washing always. Pray that it does not progress to shortness of breath. If it progresses to shortness of breath, then you have to go to the hospital because that is the symptom that will classify you already as having a severe COVID-19 disease and you will be admitted. Now, if it's management, so that's history and course physical examination. Now, if it's the management of allergic rhinitis, Doktora, during COVID-19, paano na yung allergic rhinitis ko? Aba, edi mag-ingat tayo. Yung mga alam mong kung saan ka allergic at itutuloy mo ang iyong mga gamot na inirereseta ng doktor. Doktora, may asthma ako. Kung anong reseta ng doktor, ituloy. Kasi baka pag naging out of control yung asthma mo, lalo kang pagkamalan sa triage na may COVID-19. Yung pala, asthma rin lang. Okay? Also, there is no link between COVID-19 and allergy, as I mentioned earlier. If you have allergic rhinitis, it doesn't mean you are more prone to COVID-19 than to someone who does not have allergic rhinitis. As of now, everything I'm saying is based on what is available to us now. My disclaimer always when I'm talking about COVID-19, what I'm saying now might be pag umaga na sa Europe o sa Amerika, may na-discover silang bago, hindi na pala totoo. So what I'm saying is what we know now. This is a relatively new and still evolving, meaning still changing disease. The good news is we know many things about it already, but the not so good news is marami pa tayong hindi alam. Talaga, palagay ko, mas marami pa tayong hindi alam tungkol sa kanya. At ang lumalabas nga, kahit alam na natin siya ngayon, yung virus nag-mutate. Yung alam natin now may not be true anymore tomorrow. Yes. So we all have to be careful, believe our scientists, believe our security enforcers, and I congratulate the Filipino people. Actually, in general, I think we are largely discipline because we are afraid. Matakutin ang Pinoy, takot magka-COVID-19.
Yes po.
Wala namang outright na nagagalit pa o nang babastos pag pinigilan mong magmask gaya ng nasa ibang bansa. So, we have to be informed. We have to follow our trusted physicians, our family physicians. We have to pray. That's the most important. Ora et labora, as we say in Saints Co.
Ayan. Maraming salamat po, Doktora, for your clarification when it comes to allergic rhinitis and also its relation to COVID-19. And syempre yung mga reminders po na tinuro nyo sa lahat ng viewers natin ngayon, especially sa mga patients, sa public who are very much eager of finding out more about allergic rhinitis, and the sequelae of events related to allergic rhinitis. Marami pong nagpapasalamat sa Facebook Live, Doktora, sa napakaklaro na explanation ninyo tungkol sa bagay na ito. So, thank you very much, Dr. Luisa Cruz.
Ayan, buti po sa aga, allergic rhinitis pa rin pinag-usapan natin.
Opo. Nasa allergic rhinitis pa lang tayo. No? Marami pa tayo pwede pag-usapan, Doktora. I-invite ka namin ulit, no, sa iba't iba pang mga events na mga susunod.
Hindi, I was just pertaining to, if I may share, wala naman sigurong masama, the request na wag na allergic rhinitis sa pag-usapan. And I'm very happy it turned out to be very engaging for our viewers, it seems. Okay, thank you. Kala ko kasi sawa na siya sa allergic rhinitis eh.
Hindi po, gaya na sinabi yung household, problem, no, when it comes to the health. Kaya lagi siyang nandyan, just around the corner. At the same time, yung mga tao ay kailangan pa rin talagang ma-remind not to take allergic rhinitis for granted. So maraming salamat, Dr. Techi, for making this birthday episode special. Ayan. Thank you so much, Dr. Techi.
Ernest, balik mo naman yung picture namin ni Boss Aga. Yan. Picture.
Ayan, makikipicture din yung mga Facebook Live viewers natin na nanonood ngayon. Ayan, marami pong bumabate. Nagpapasalamat po sa inyo, Doktora. Ayan.
You're welcome po. It's always my pleasure to share. Hindi po ako superior sa inyo. Ito lang po ang napag-aralan ko sa buhay. Kaya gusto ko po laging mag-share. Nagkataon lang po, nasa posisyon ako na may kaalaman.
Correct. Thank you, Doktora, for sharing your expertise with us this afternoon and being with us in this very special episode of Health Talk. Yeah.
Happy birthday!
Salamat po. Ayan, so maraming salamat again, Dr. Techi, for that very informative discussion. It's always a pleasure to have you with us. And of course, maraming salamat sa mga nanonood sa atin ngayon who are staying with us in this episode of Health Talk and joining us in this birthday episode. Maraming salamat sa aking Zydus family sa mga greetings, mga surprises, at itong inyong binigay na birthday cake. Ayan, binigay ng Zydus. Thank you. Ayan, bigla akong na-blow. Happy birthday to me. Ayan, thank you sa shoutout sa aking Recipe family, Zydus Recipe family, at Angkar Diva, CND, and of course CNS and Onco team of Zydus. Ayan, maraming salamat po sa inyong lahat. And please always stay safe. Ayan. Thank you and have a great day, everyone. Bye.
Zach at Zydus brings you a patient care program, Health Talk, a lay forum that gives various information on illnesses and diseases with advice from medical experts. Join us live on Facebook.